Hey everyone, and welcome to MediBytes. When we think about polio, we often think of a battle that was fought and won a long time ago. But what if I told you that for millions of survivors, the fight isn't quite over? Today, we're diving into something called post-polio syndrome. Right? It really does feel like something from the history books, something we've conquered. But for the people who survived it, the story can take a turn. The real question, the one we're exploring today, is what happens decades down the road, long after they've seemingly recovered.
All right, so let's get right into it. To really grasp what these survivors are up against, we need to first ask, what is post-polio syndrome?
Okay, so post-polio syndrome, or PPS for short, is basically a delayed reaction. It's a set of new symptoms, and we're mainly talking about muscle fatigue and weakness, that suddenly appear many, many years after a person has already recovered from polio and has been stable for a long time. And this timeline is really the key thing to understand. This isn't something that pops up a year or two later. We're talking about a huge gap, sometimes 30, 40, or even more years passing between the original polio infection and when these new symptoms start to show up. It's a long, long wait. So this naturally leads to a couple of big questions, right? Does this happen to every polio survivor? And why on earth does it take so long to appear? Let's take a look at who's most at risk and what scientists believe is actually going on. Okay, so research points to two main risk factors. First, age plays a part. It tends to show up more in older adults. And second, and this is a big one, is how severe the original polio infection was. Survivors who had a really serious case, the kind that caused paralysis, are much more likely to develop PPS down the line. Now, as for the cause, well, it's not 100% certain, but the main theory is pretty fascinating. It all boils down to the nerve cells, specifically the motor neurons that control our muscles, the ones that actually survived the first attack from the polio virus. Think of it like a small team of workers left to do the job of a much larger crew. After the polio virus destroyed many of the nerve cells, the survivors went into overdrive. They sprouted new connections, took on extra work. They basically carried the load for decades, and they did an amazing job. But after all that time, after working so hard for so long, the natural effects of aging start to kick in, and these heroic, overworked cells just start to get tired and weaken. So you have these exhausted nerve cells. How does that actually feel for a person, and what makes it so tricky for doctors to diagnose? Well, the big ones are muscle fatigue and a new or worsening muscle weakness that just seems to creep in. People can also experience muscle pain and sometimes even see their muscles getting smaller. That's called atrophy. And here's a really important clue for doctors. A lot of the time, these new problems show up in the exact same muscles that were hit by polio all those years ago. And this leads us to maybe the single most important point of this whole discussion. If you're a polio survivor and you start feeling new weakness, does that automatically mean you have post-polio syndrome? The answer is a very clear and definite no. And here's why. The thing is, a lot of other common health issues that come with getting older, things like diabetes, arthritis, even a herniated disc, can cause symptoms that look exactly the same. That's why it is so important for a doctor to do a full workup and rule out everything else before landing on a PPS diagnosis. It's a process of elimination. Okay, so let's say the doctors have ruled everything else out and the diagnosis is confirmed. It's post-polio syndrome. What happens then? How do you manage it? All right, the first thing to know, and it's important to be upfront about this, is that there isn't a cure for post-polio syndrome right now. And that can be tough news to process, for sure. But what it does is shift the entire focus onto what can be done, and that's managing the symptoms to maintain the best possible quality of life. And that management is all about supportive care. It's totally personalized. There's no one-size-fits-all solution. We're talking about things like physical therapy and really specific exercise programs, but the goal here is different. It's not about no pain, no gain. It's about maintaining function, learning to conserve energy, and supporting those muscles without pushing them past their limits. So as we start to wrap this up, if there's one message, one single takeaway for every polio survivor, their friends, and their families, this is it. I'm going to say it again because it's that important. New symptoms of weakness in a polio survivor are not always due to post-polio syndrome. Please do not try to diagnose this yourself. It could be something else entirely, something that's treatable. Getting a proper, thorough medical diagnosis is absolutely essential to get the right help.
And that really leaves us with something to think about, doesn't it? Understanding this condition isn't just about the science. It's a powerful reminder that an illness from childhood can cast a very long shadow. It makes you wonder, how can we as a community do a better job of supporting the long-term health of people who have already overcome so much? Thank you so much for joining us here on MediByte today. If you found this explainer helpful, please do us a favor and help spread the word by giving it a like and a share. And of course, don't forget to subscribe so you don't miss our next Clear Health Explainer. We'll see you then.